Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to cover low back pain and the contributing factor to low back pain of core muscle weakness. I already did a video on weakness in the multifidi muscles, which are considered core muscles. The multifidi muscles are the deep muscles in the lumbar spine. But what I'm going to cover today are the deep muscles in the abdomen and how weakness in these muscles can affect the lumbar spine and why they are a contributing factor to low back pain. Weakness in the core muscles is one of the most common contributing factors to low back pain. Low back pain is one of the most common health problems worldwide. It will affect approximately 80% of people at some stage in their lifetimes. Low back pain is a major cause of disability. In the athletic population, low back pain is one of the most common reasons for missed playing time. Pain and symptoms of low back pain may persist for years. Prevention makes up a large part of low back pain treatment. Exercise and manual therapy are the most common non-invasive and conservative interventions for low back pain. Exercises have become the cornerstone of treatment and prevention of low back pain. Exercise is the most common conservative intervention for chronic low back pain. Low back pain is frequently correlated with faulty posture, such as excessive lumbar lordosis or curvature. Excessive lumbar curvature may be associated with over-lengthened and weak deep abdominal musculature. Poor neuromuscular control of the core muscles, specifically the transversus abdominis, the internal oblique, the pelvic floor, and the diaphragm, has been described in individuals with lumbar spine and sacroiliac joint pain and in individuals with lumbar segmental instability. Spinal stability is achieved by the lumbar multifidi muscles working synergistically with the abdominal muscles, pelvic floor, and diaphragm. The deep core musculature consists of the transversus abdominis, the internal oblique, the multifidi, the diaphragm, and the pelvic floor muscles. Motor control errors or lack of deep abdominal and multifidi muscles acting before larger global muscles increases compressive forces across spinal segments and results in pain. Motor control exercises involve retraining the multifidi muscles and the transversus abdominis muscles to become active before larger global multi-segmental muscles become active. Spinal stabilization exercises improve spinal stability by improving trunk muscle coordination and anchoring the deep musculature, which prevents overactivity of the superficial musculature. Meta-analysis has shown that spinal stabilization exercises are among the most effective forms of therapy for improving low back pain. Stabilization exercise programs have been widely applied for low back pain treatment because they are effective in reducing low back pain and disability associated with low back pain. Stabilization exercises aiming to improve the function of specific trunk muscles supposedly control the movement of the spine. Through the regaining control and coordination of the spine and pelvis, these exercises could be effective in the treatment of low back pain. Exercise can help strengthen muscles and maintain asymptomatic lumbar curvature. Lumbar stabilization exercises can provide therapeutic benefits in the treatment of chronic back pain through increased dynamic stability and increased lumbar muscle strength. Suboptimal breathing patterns and impairment of posture and trunk stability are often associated with musculoskeletal complaints such as low back pain. Therapeutic exercise that promotes optimal posture, diaphragm and lumbar spine position, and neuromuscular control of the deep abdominals, diaphragm, and pelvic floor are desirable for utilization with patients who demonstrate suboptimal respiration and posture. Strengthening of the deeper core muscles is imperative in the prevention of the first episode of low back pain and also in recurring episodes of low back pain. There are numerous exercises that can be performed. These include the abdominal drawing in maneuver, the pelvic tilt, abdominal bracing, the 90-90 bridge, pelvic tilt on the football, and numerous other exercises that you can perform to help to strengthen the transverse abdominis muscles and the internal oblique muscles. You can also perform what is called abdominal Hallowing. Abdominal Hallowing is a stomach vacuum that is going to help to strengthen the deeper core muscles, including the transverse abdominis and the internal oblique muscles. Now it is time for the disclaimer. I have to put a disclaimer in all these videos to make sure everyone understands viewing this video does not take the place of seeing a medical professional. Please see a medical professional to get an evaluation, diagnosis, and treatment plan. Again, seeing this video does not take the place of seeing a medical professional. You can work with a rehabilitation specialist or with a fitness professional to learn proper exercise technique and help yourself to develop an exercise program that will help you to prevent low back pain and will help to prevent a recurrence of low back pain or to help you rehabilitate low back pain. Never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, please stop immediately and find a viable substitute. Never perform a motion that elicits or intensifies symptoms. When you are performing an exercise, always work through a symptom-free range of motion. Even if that range of motion is minuscule, you always want to work through a symptom-free range of motion. When performing an exercise, always start at your current health, strength, and fitness level. Never try to start an exercise at the same level that someone else is at, or what you used to be at before you got injured, or what you used to be at when you were in better health or fitness, or what you used to be at when you were younger. Please start any exercise at your current health, fitness, and strength levels, and slowly, gradually increase the intensity in small, gradual, calculated increments. Again, always increase intensity of your exercise in small, gradual, calculated increments. Strengthening the deeper core muscles is vital in the prevention and rehabilitation of low back pain. Do yourself a big favor and strengthen the transverse abdominis muscles. You can use the stomach vacuum, which is also known as abdominal Hallowing. You can perform the abdominal drawing in maneuver, the pelvic tilt, the football pelvic tilt, and the 90-90 bridge. These are fundamental core strengthening exercises that will help to strengthen the transverse abdominis muscle. When performing any type of strengthening exercise, you always want to perform that exercise with a rest day in between. Never perform the same strengthening exercise 2 days in a row. You always want to give your body a chance to recover from your exercise. Especially if you are sore in that area, you can take a second rest day. Use common sense and listen to your body's signals. Again, never perform the same strengthening exercise 2 days in a row. All of the exercises that I mentioned, I do have videos for those exercises, so I'm not going to repeat them here because that would make this video way too long, but I will put connections to those videos. I will put a link to those videos for those exercises in this video so that you will be able to see me demonstrate and describe how to perform these exercises that will help to strengthen the deeper core muscles. Low back pain is a common issue worldwide. As a doctor of chiropractic, I treat many people with low back pain and symptoms. One thing that I always do is I try to give them strengthening exercises for the deeper core muscles because it is such a contributing factor to low back pain. It is so common in low back pain. So do yourself a big favor and prevent low back pain by strengthening your deeper abdominal muscles or rehabilitating your lumbar spine condition. The lumbar spine is the medical name for the low back by performing strengthening exercises for the deeper core muscles, or prevent a recurrence of low back pain by strengthening the deeper core muscles. Thank you, everybody, for watching today's episode of Dr. Ozello Sports Medicine Report, where I covered core weakness as a contributing factor of low back pain. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You could visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can also find my blog on my website. My blog contains articles on spine health, sports medicine, health, fitness, exercise, and nutrition. Again, that is championshipchiropractic.com. Please feel free to like this video. If you have questions, feedback, or suggestions, you can leave them in the comments section below. Also, please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. Always remember to train hard, but train smart. Get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free. Rehabilitate your injuries. Prevent a reoccurrence of your injuries and accomplish your goals.